And once again, welcome back. Dr. Card was joining us. He's the Chief Medical Officer at McDonough District Hospital, continuing to answer your questions. This one is brought into us from Janie McIntyre. Are hospital employees being notified if they have been directly exposed by a COVID-19 patient? Doctor?
We have not yet had anybody in the hospital who's COVID positive, but certainly that is part of our protocol, that anyone who has had an exposure will be notified. The current guidance is that they can continue to work with a mask in place as long as they are asymptomatic. If they develop any symptoms at all, then they go home and are isolated.
Very good. How are you handling patients coming into the ER there if they believe they have COVID-19?
We have two tents at our entrance. One is for specifically respiratory problems. Anybody who enters through that tent gets screened as to whether or not they need the emergency room or if they can go home and call their physician. Those that do go into the emergency room have a mask placed on them immediately and are taken directly to a room if one is available and evaluated there with the door closed to minimize the amount of potential contamination in the emergency room.
Very good. We have an email sent in to us from Kelly Shiraki, and she wants to know if COVID-19 has the ability to mutate in a similar fashion like the flu, changes every year.
COVID-19, like any virus, has the capability of mutating. So far, it appears to do so very slowly, unlike flu, which mutates very rapidly. The good news with that is that with that slow rate of mutation, the possibility of a vaccine working long term would be significantly higher. That remains to be seen, though, at this point.
Very good. Joanne Hickman also sent in her question to us. If a person was diagnosed with an upper respiratory virus at the end of February, could it have been COVID-19 when less was known about the virus at that time?
It is possible, certainly, but COVID usually tends to be a lower respiratory illness, more in the chest than in the head and neck. So a typical upper respiratory tract infection probably was simply a upper respiratory tract infection and unlikely to have been COVID.
All right, Dr. Carr, we certainly appreciate that. That's all of our time that we have for our TV broadcast this evening, but our conversation will continue until 7 p.m. on News Talk 105 WGEM. We'll start at 6:35, and of course, you can also join us on our WGEM FM mobile app as well. Dr. Carr, we certainly thank you for joining us this evening. I'm Tony Cornish Jr. We'll see you later tonight on WGEM News at 10. Until then, stay safe.